Hi, everybody. I'm Julia diLiberti. I teach humanities at the College of DuPage. I'm the faculty liaison for global education. And today I'm with two architects and two faculty members at the College of DuPage, Jane Ostergaard. And Jane, if I mispronounced your name, I hope you'll correct it. And then Mark Pearson. And I'm going to ask Mark and Jane to talk a little bit more about who they are as architects. And then of course, as you know, I always have questions for people, so then I'll ask away. So Jane, would you tell us a little bit about who you are and your time at COD, and Mark, same after Jane.
Okay, so I'm a licensed architect. I practiced architecture for several decades. Before coming to COD, I've been full-time faculty at COD since January 2000, and professor and coordinator of the Architecture and Construction Management program at COD.
Thanks, Jane. Mark.
I'm Mark Pearson. I'm also a licensed architect. I did mostly public sector work before coming to COD, worked on a lot of public library projects, and I've been a full-time faculty member in the architecture department at COD for the past 16 years.
Oh my gosh. Wow. I didn't realize. Okay.
Time flies.
I always think you're like the new guy, Mark, because you came, I guess, just a year after me. But if you and Jane was already on committees when I got here. So, well, I guess I want to start out by talking to you guys. I read a few articles, and I think I told you guys my favorite was this New Yorker article I read by Kyle Chayka. Anyway, he's sort of talking about buildings and disease, and he gives the example of the Finnish architect who designed a sanatorium, and it said that when he designed the sanatorium, that for him, the building was part of the cure. The ceiling color was supposed to be silent and calm the patient, and he had big windows, so that light could help cure the TB. And so the author of this article talked about us once again being us being once again at the juncture of disease and architecture. And I wondered, sort of what you thought about that phrase. And I wondered if you guys could even talk about the impact of COVID on current and future architecture. So who wants to take all those thoughts and unpack them and start talking? Mark, do you want to start?
Go ahead, Mark.
Well, one of the things I've been thinking about is kind of the idea of like temporary versus permanent. I think we're seeing a lot of like kind of design hacks at the moment. Like you go to the grocery store and you see stickers on a floor that tell you which direction you can walk and where you can stand for social distancing, and plexiglass incorporated, into the cashier's checkout stations. And, if you go to the doctor, you're pre-screened before you get into the building. And so, I think some of these things are going to move from sort of temporary design hacks into permanent kind of space planning features. But the interesting question is, what things are going to be permanent and what things are going to go away quickly when the pandemic is over. So that's I think a harder question to kind of get at. I think that there's this notion to say, well, like for example, after 9/11, people said no one's going to want to work in a high-rise office building again, but that didn't actually happen. Things went back to normal pretty quickly, although the way we access an office building is totally different now than it was before 9/11. So I think clearly there are going to be things out of this pandemic that affect the way we think about spaces, but it's hard to sort of predict what permanent impacts those will have on the profession. I do think a lot of the kind of social distancing things that we see are being kind of hacked together ad hoc right now will probably have an impact on design and space planning moving forward, but not all of them. And so that's kind of the interesting question for me to think about.
I will say one architect kind of earlier, a guy named Eidenberg said that he thought that tape is one of the greatest materials of architecture right now. So it sort of ties into your, but the idea that one article I read said that this idea of office buildings wanting to house 7,000 people at a time may be changing. And so, Jane, you're nodding. Do you want to sort of take up that?
Yeah. So the pattern of office use has been transforming for the last 40 years, where it went from private offices to open office cubicles, the cubicle farm. And then it had recently moved to hot desks where you had your laptop and you just plopped wherever you wanted, and people were fluid and teams rearranged. And this was a direction that was really gaining momentum, and there were a lot of varied spaces within office areas so that people could find different parts that they were most comfortable with at a given time or a given activity. And now that's completely flipped, because I think one of the aspects of this that is perhaps unfortunately most enduring is we're afraid of each other. That our colleagues become sources of contamination, and we feel at risk and vulnerable when we are interacting with other people. So that's not an architectural issue, but a societal issue. And so in terms of offices, though, you don't want to touch the surface somebody else has touched. You want to have your space that you can control. And with that, more and more people will be working from home to be able to have that. So I think we're going to see the offices themselves be more permanently structured as they had been in the past. But we're also going to see a lot more remote work. And we need to really think about the psychological aspects of that, the isolation that you have when you're working alone at home, or when you can't collaborate with your colleagues and interact with them comfortably.
I forget which Ivy League school has the most Nobel Prizes. I should know that, but apparently they think it came from this idea that it was sort of they just put people in offices where they fit, and there was all this cross-pollination between disciplines in the conversations in the hallway, and they felt like, so that speaks a little bit to that. And I think you were talking about this shift from open spaces to what an author called defensive spaces, and I think, Mark, you were sort of talking about that with plexiglass and stuff. So where else, and you mentioned some things like city offices and public spaces or workspaces. So do you want to talk more about other ways those will be affected and other types of spaces that might have to make adjustments for this?
I think the work from home experiment is going to have a lasting impact on all of us to some extent. And so as more people are working from home, it shifts the types of spaces they need. You need a room where you can close the door. The open loft concept in apartments is probably going to be less desirable in the future, as a kind of blanket model. And so I think it might affect the types of spaces people desire in their homes. I'm sitting at a card table that I set up kind of temporarily because I had to bring everything home. I think as people start looking at the types of spaces they want in their housing, having a place to work from home, I think, is going to be a primary concern. And I think offices too, this kind of work from home experiment to some extent has worked, I think. And I would imagine that companies may not want to invest as much in office space. It's expensive, and if they can get by with less. So those kind of things, what it takes for all of us to kind of work out of our homes, I think will impact, the way we think about spaces in residential design too.
Jane, I guess I was just going to say too, if you've got more than one person, right, Mark, you've got a place where you can shut the door, but if you've got more than one person in a loft area and you're all trying to work together, right? Jane, I'm sorry.
I read one article that architects are rethinking kind of city loft apartments because of that. If you have more than one person on a Zoom at a time, you need to be able to subdivide the space.
Or if one of the people is sick and needs to be quarantined, you can't really quarantine them.
Right.
And I think these issues play out in schools. I was looking at an article where they were looking at the layouts of nurses' offices so that if they had multiple students come in with symptoms, how they could quarantine within the nurse's office. And that's, you think about any school nurse's office you were ever in, probably was barely larger than a closet, and certainly didn't allow for multiple students to be quarantined. So the colleges that are looking to reopen in face-to-face formats, I cannot really fathom how they're imagining this working. And so I think that's another thing long term. Will we have things like double occupancy or triple occupancy dorm rooms and the suites and things like that, where there's more potential for contamination? It's such a Mark's comment about the temporary versus permanent. It's like, okay, our expectation is this particular situation is going to end sometime in 12 months, 18 months, 6 months, sometime when there's a vaccine. But the epidemiologists have been predicting something like this for decades. And now that it's happened, I think we're always going to be aware it could happen again.
So how do you guys plan as architects if COVID does go away and the vaccine works and all of a sudden and people have planned for buildings where people are going to be quarantined and that doesn't, how do you plan for both eventualities? Or has that even come up?
Well, architecture isn't quick. So, it's like companies right now are probably not planning for anything permanent because who knows what it's going to be. They are perhaps stopping some plans that they had, where they had perhaps planned on having a very open office and we're in the process of building that they've stopped. But I don't think we're going to see really major redesigns starting or new designs starting until probably next year. And at that point, it will be more, what do we do if? And I don't know. I don't know what they'll do, if they'll have quarantine zones or.
Mark, I think Jane too, you both mentioned this idea of flexibility in design coming up. So Mark, anything you want to add to that series of thoughts?
I just think some of these things, like I said at the beginning, that we're sort of seeing as a kind of temporary design fix will start to have space planning implications. And, if they're, hopefully if there's not a pandemic, then those things are pretty seamlessly integrated into the design, so you don't really notice the difference. But if a space needs to be, isolated, or, I think these things have been happening in healthcare design for a long time, but, the ability to shift rooms in a hospital into isolation rooms or negative pressure, for those kind of things. I think the stuff that's kind of been happening in healthcare for a long time, where things can be pretty seamlessly transitioned if the need arises.
Okay, so
we're going to start to see some of this in normal building design, bigger, circulation spaces that can be partitioned off, but it's hard to predict. That's my thing, is that I think we have the ability, like as humans, to like go back to normal pretty quickly. And so right now, in the midst of everything, it's easy to say it's going to change everything, but it'll be interesting to see what actually sticks, because if a vaccine comes out and it's successful, we could go back to kind of normal.
7,000 person offices in a nanosecond, right?
Yeah.
I think there will be some things that we may just accept as normal, just as after 9/11, the security measures, the kind of barricades that exist around government buildings now are normal. But I think, a lot of it will be more behavioral things. Like, I wouldn't be surprised if salad bars just disappear, and they've always been contagion vectors for whatever, and so the risk to benefit ratio will be seen like, why? We can
right.
just do it a different way. I think one of the areas that we're likely to see maybe a more permanent change is one that's invisible to a lot of people, and that's air handling in our buildings. You know, we're going to right now they're looking at, normally buildings recycle a lot of the air because it's already heated or cooled, and you just add a little bit of fresh air, which is part of why airplanes are such germ containers. So now they're changing the settings where possible to bring in more fresh air to reduce the amount of recirculated air. New equipment will have more controls that will allow more flexibility for things like that so that they can adjust to a given situation. There are different qualities of filters that you can use in your air handling, you know, that have different ratings in terms of contagions. Obviously, hospitals use ones that are of a different standard than other buildings. So I think those things will become more normal, and that will be important. But some things like elevators, you know, how do we handle those? Maybe they all get equipped with ultraviolet lights or something that help cleanse the air. I don't know. You know, I don't know what it's going to take. And I think that's one of the big questions. Right now, we don't know. We don't know what is going to work.
I read about this movement towards self-cleaning bathrooms, and I was wondering, you know, what that would look like. And I'm like, I'll take one. But you know, I mean, then do we get these self-cleaning elevators? And I wonder how far that technology's off, or maybe there's already some self-cleaning bathrooms that exist that I don't know about. But I think you guys talked about more flexible hospital rooms, and I think we saw that too here with, you know, in New Orleans, they repurposed something, McCormick Place, right? That was repurposed from an expo center.
One of our students worked on that project. One of our
Any
alumni.
insights? That's very cool. COD has far-reaching arms. Let me say that. There's going to be new forms of public space, and I was reading that, and I think it's happening here too. But in Lithuania, they talked about how they closed off a bunch of streets so that restaurants could open and have people. And one of the Greek architects that I was reading about said, you know, gosh, there's all kinds of people circulating downtown but there's no retail or no commercial purpose going on. So how are we going to capitalize on that, and not in a mean way? How are we going to sort of support that, right? Mm-hmm. And so I guess I was in New York. They have they're going to turn in 40 miles of streets to pedestrian routes, and in London they're talking about almost the same amount or a little bit more. I thought I read like some huge number of miles for bikers. And so I kind of go back to this idea, Mark, you were talking about whether 7,000 person building employee buildings are going to exist. And Jane, you said, I think that we still kind of want community as people. So how do we reshift? So you guys have already talked about adaptive reuse. One of the things I read is that buildings might become more modular because that's faster and flexible. And I guess I'd be curious to hear about your thoughts on that. And then there'll be new innovations in lightweight architecture. So is this true? Is this science fiction? Is this fantasy? Is this immediate solution?
I'd like to go back to the city planning part of that for just a second, because that's one of the things I'd like to see come out of this is more cities thinking about, you know, turning streets into pedestrian, you know, amenities. I mean, a lot of cities have experimented with, you know, closing streets to cars and letting bikes and pedestrians and now restaurants open into those streets. Some of the suburbs in the Chicago area are doing that.
Right, it's true right now for restaurants, right? Yeah.
Yeah, and you know, obviously with the restaurant part is sort of an immediate fix for a problem, you know. But you know, I guess I kind of hope that city planners will look at these sort of, again, experiments that are happening because of this and see potential for the future to make cities more livable. In terms of the modular question, I mean, I think a lot of the prefab modular things it's not a new concept. I don't know if the pandemic affects this or not, really. I haven't thought about that part.
I guess it's something I had read, and I was curious to know from the professional perspective. So no, I'm happy to, I'm happy that it's still an emerging issue, so I can hear more later. Jane, I'm sorry, you were going to
you know, like modular, it isn't really like that much quicker, and it certainly isn't that much. It's not really transformable. It's more of a kind of structural bay. It's used a lot in residential architecture, and a lot of times it can be used to reduce cost. It can be used to control situations, especially like if you have a really hostile environment, a really limiting environment because of weather or terrain or something like that. Building things in a factory can be a really efficient way to do it because you only have a short building period, or you have significant challenges in the building site. But things like temporary construction, the kinds of things that they bring into disaster reliefs, and those, I think, again, they've been around for a while. They've been around at least since World War II on one level or another, but they have limited effectiveness, especially like, a lot of these things that we're talking about now, bike paths and closing down streets so that the restaurants can move out into them. That works great in July and August and September and maybe October. But come November, it doesn't matter. It's just going to be too cold. So how do we go on living then, and how do we keep businesses functioning? How do we have entertainment industry? And these are really big issues that are beyond the architecture, the structure of the environment.
So Mark was talking about how he'd like to see some of the city planning change, and I guess I might want to go back to that just for a minute, but before we do that, Jane, what, how would you, are there things that you would like to see be permanent as a result of, COVID forcing discussions about architecture that maybe were going to come anyway, but made these discussions very present, very immediate?
Well, I agree with Mark. I think those urban planning directions would make cities a lot more habitable for humans and less habitable for cars, which I think is a good idea. But on the other hand, the whole issue of this that we've tested working from home and found it a lot more workable than we thought, will we see a lot of people leaving cities?
Oh, that's interesting. Gosh.
Because if I can work from DeKalb as effectively as from State Street.
And the truth is, even 10 years ago, 5 years ago, Zoom wasn't accessible. Like, Zoom has made made this possible, right? We can have meetings. Jane, how many meetings did you say you had today? This is number 5 for you, number 4? But again, because we didn't have the technology to maybe allow for easy and effective remote teaching. Remote teaching will never be the ideal, but you know what I'm saying. It can be done. But what were you saying?
The bandwidth, just right. That's generally accessible, but it also just points up all of the inequities in our society. That we can do this. We all have the computers, we have the bandwidth, we have the physical space to do it. That's not true for all of our students, and it certainly isn't true for all of our society.
This is completely unrelated, and I just thought of it. So if you're like, what? We don't even want to talk about that. That's fine. But I know in the Renaissance, when they first started building buildings, the idea was to inspire the people who lived outside of those buildings. And it was supposed to sort of be a lesson to what they could aspire towards, and it was also supposed to reflect good citizenry. And I'm just wondering if where COVID might take us, might be taking us back to the idea of inspiring good citizenry, or if it might be taking us all into permanent isolation, or you can be a good citizen in isolation. But so my question wasn't really well thought out, and but I guess I was just sort of curious about how this will affect what the purpose and meaning are buildings supposed to have meaning, or are they supposed to have purpose? Well, I like it. You guys are so unified on your look. That's hilarious.
I mean, I guess one of the things I've been thinking about is the kind of irony of, right now, because of the pandemic, we're all kind of isolating and social distancing, but architects really like to think about spaces that bring people together and the need for good public spaces in cities and communities. And so I don't know what all that means for the future, but my hope is that that we don't just start focusing on designing spaces for isolation, that there will be a return to like civic public life, and that those types of spaces are still really important. That's why I said I hope that some of these experiments in a more pedestrian-friendly city will stick, because I think that after we're done kind of isolating on this level, there's going to be a need for those types of spaces to make our lives more livable, right? To make cities more livable, to make places and spaces for people and for human contact. And that's sort of one of the ironies right now, is that all the design things we're talking about are designed to keep us away from each other and from spreading disease. But we do need that human contact, as Jane mentioned earlier. And architects are really good at thinking about spaces that bring people together.
Yeah, I guess.
Hopefully we'll get back to that.
Yeah. Well, okay, before I let you guys sort of just answer whatever questions you want, but I guess I'm curious too, how is this coming up in your classes? Are you talking to your students about the overlay of COVID on the discipline, or are they not at the level where they have to even sort of be thinking about that? Or
I haven't been talking about it in this way, but we have been talking about like this interface as really important for their future professional careers. So being able to work and design and communicate with each other digitally, I think is important. I think that was a good learning experience for the Spring Studio. I don't know if it's impacted the conversations we have in class yet. It might in the fall, where we're doing everything kind of more remotely. I don't know if Jane has a thought about this. But.
Well, I think, in terms of designing spaces, most of our students are, we're at a much more elementary level. How do people walk through a space? What do they see? How much head height do they need? How do we make a space that does inspire them, something that's memorable, that is worthwhile, that serves its function? And hopefully, we all get out of our bedrooms and actually go to museums and things like that at some point in the future. But, I've been working on trying to figure out how to put students safely into classrooms. And it's really challenging, especially if we're going to let them move around.
Right.
And so, there's just so many different issues that I think are going to change our perception of society. And it's like, what are our rights? What are our freedoms? What are our responsibilities as shared tenants of the world? And what behaviors can I modify so that we can all safely move around together again? And finding those standards, I think, are going to be more fundamental than the physical environment. I think it's going to be those social structures.
Yeah, interesting. Truth. So, Mark, were you going to add something? No. Well, so before we end, let me ask you guys to have the conversation you would have had if I weren't here. What would you have said to people about COVID and architecture, or just architecture in general, that you want us to know before we take off?
This was kind of the conversation we've been talking about offline too. I mean, it's interesting as in the design profession, just think about how will all of this impact the spaces and places that we live in. And I think we all know as designers that there will be an impact. Again, back to kind of what I started off with, it's hard to sort of predict exactly what what aspects of this are going to be the things that are going to find their way into either building codes or, design standards or things like that. But I think it's always really interesting to kind of think through this time and think about, I guess that's the question everybody can ask themselves is how do you think this is going to change the spaces and places that you live in or that you want to live in? And that's an interesting question as a designer to tackle, and I think the answers will come over time.
I love it. So far you guys have a more optimistic vision than I do, so I'm happy to talk to you because it gives me something to think about later today, like the good stuff. Jane, what would you add to the discussion?
This is just a kind of minor thing, but I think one of the things that is pretty pervasive in the States, not necessarily around the world, is all of the touch-free plumbing fixtures and doors and things like that. And I think that that's going to become ubiquitous. It's just going to be like, of course you do it that way. Why? And I think that, my grandchildren will be like, what? Like, how does this faucet work? They'll look at a faucet the way the current teenagers look at a rotary dial phone.
Right. You actually had to touch it?
Like, what? So, and now, there's no paper towels in any dispensers anymore. So I think some of those things will just, be automatic. As Mark said, the kind of sneeze screens around the cashiers will be part of the basic structure, because why not?
Yeah, I guess that's true, right? Any other parting comments, Jane or Mark, before we take off? I really am happy that you're thinking about structures and social structures in terms of communication, because I'm a little pessimistic and thinking this will be permanent, and I don't like that. So I'm happy that you guys are saying your job is to kind of get me out of my funk. That is your sole job, but on a greater scale, that your job is to sort of allow people to come back together in some. So I appreciate I appreciate that, and I appreciate the conversation. And thanks for coming today.